Welcome back. April is Black Maternal Health Month, which is a time to spotlight the deep racial disparities Black women face in pregnancy and childbirth. One of the most overlooked issues is stillbirth, which, hard to believe, claims over 20,000 pregnancies each year in the United States. Black women are twice as likely as white women to experience this devastating loss. Despite proven steps that could save thousands of babies, the U.S. lags behind other wealthy nations in prevention, ranking 48th out of 49 high-income countries. Joining us is trauma therapist and director of outreach at Push Pregnancy. It is Marjorie Vail. Marjorie, so nice to have you on our program.
Thank you for having me. I'm really glad to be here.
Marjorie, I just looked it up and I found out that PUSH is called the Perinatal Unit for Systems of Health. Tell us, before we get started and get right into all the other issues, about PUSH. What is PUSH? What was it created for? And what is it all about? And basically, what do you work on every day?
So, Push was created by eight lost moms. All of us mothers, we had all had stillbirths in various weeks of gestation, and we wanted to do something about it. We wanted to not only focus on a stillbirth in America, the United States, but we also wanted to focus on Black maternal health, connecting ourselves with our international partners and here in America. So we're on a quest to reduce uh, preventable stillbirth by 2035. So our daily activities is just that. How can we get involved in research? How can we connect with other organizations? We're involved in paid family leave in New York, and so our goal is simply that to end preventable stillbirth by 2035.
If there was equality across the board, we might not be having this conversation in this way. Let's just get right into it and not be shy about it. Let's just talk about the racial inequalities that exist in the care, in the treatment, in the education of it. This is really the bottom line. Now, I will tell you that maybe a couple of weeks ago, I did an interview with the Bronx Borough president, who is a black woman who has put this notion of maternal health right at the top of her list because she said it's something we understand that the rest of the world has missed.
Right. I think the biggest concerns is that Black mothers are often ignored, dismissed, gaslighted, and we often are the victims of delayed critical interventions. Many Black women have lack of access to quality care. We struggle from stress, from racism in everyday life. There's economic inequalities, and those are the things that worsen the outcomes for our pregnancies. And so it's a big issue. Not only are we 2 to 3 times likely to have a stillbirth, we're 5 times as likely to die giving birth as well. And so it is a major crisis that is not being taken care of, is not being looked at.
You use the word gaslighted, and listen, I'm a white man, there's no hiding that. I just cannot believe. Listen, it's one thing when you call a friend and say, hey, you want to go have dinner with me or something, and they
Right.
don't respond and they gaslight. But if you're a woman who's pregnant and explain to me how that works, or what the heck is going, how do you, if somebody called me and said, I've got an issue, I don't have any experience in this realm, but I
Right.
would help.
Right.
How is it possible that women, like, what happens in there? What happens when somebody tries to reach out and then gets ignored?
Well, I can share my own personal lived
Please do.
experience.
Yeah.
I my stillbirth happened 21 years ago. It's going to be 21 years in September, and I was delivering at a hospital that had a birthing center. And let me tell you, I basically was laboring by myself. Uh, the support was limited, and honestly, I didn't get the quality care. I didn't get the focus until it became an emergency. I was saying that I couldn't, I wanted medication. uh, I wasn't listened to. And it was as if I was not being honest at the fact that it was very challenging for me. And although my initial goal was to do it without medication, when I did say I wanted it, no one listened to me until it became an emergency. And let me tell you, it became such a bad emergency that when I got to the operating room, they started to cut me without anesthesia because it was such fast pace. And so just that point where I was just not heard, it just started, it made me feel like, okay, am I exaggerating? Is this not labor? It was my first child. And so you start to feel like maybe it's just me. And so these are the gaslighting that are happening to black women on a daily basis.
I have to say this, it's horrible to just even consider it. Do you think it was a case of the hospital just being too busy? Or do you think, and let's be honest, actually it's because you're a black woman, and if there was a woman of another ethnicity, a white woman or otherwise, who was asking the same thing, that she might have gotten heard? Or do you think the hospital is just so inefficient that they couldn't keep track of anything?
Well, I can't answer that, directly in a sense where I know, but numbers don't lie, right? We're saying that black women are dying at a high rate. That means something is happening, right? There's a disconnect somewhere. And when you think about it, CDC just put out a new report that maternal mortality has decreased in all demographics except for black women. So something is happening, right? So somewhere, everywhere, black women are not being heard and therefore are dying at a high rate.
I'd like to, since you're here with us and talking openly, I really, which we really do appreciate. Um, the long now you said it was 21 years ago.
Right.
Do you still mourn in your mind? I mean, I realize the trauma of the incident you're going to have for a long time, but do you still mourn about the baby that you didn't have? You
Absolutely.
do.
Absolutely. It's a good question. I absolutely do. Especially because I have a rainbow baby, and a rainbow baby is a baby that was born after a perinatal loss, or in my case, a stillbirth. And he's 18. And when I look at him, I realize there should be two. And often he speaks about, I wonder what my life would be like if my brother was here. And so it's not a tragedy for the moment, it's a tragedy for a lifetime. And so I think the world, sometimes our legislators, our medical providers don't realize it's not a loss for a moment, it's a loss for a lifetime.
I couldn't help but notice your smile when you talked about your son. And you
Yeah.
immediately lightened up. And that's really what every woman, a black woman, any woman deserves to have that feeling. Um, how do we remedy the whole gaslighting thing? Because aside from the fact that maybe the hospital was completely out of control, but you say the numbers
Right.
are across the board. How do we recognize and remedy this whole idea that, which I'm sorry, I can't get next to it, that women, any woman, any person in this condition is being ignored? How do we
Right.
address it? What do we do? Wring their little
Well, I
necks? I mean, what, what do
Well,
we
I don't
do?
know if you've seen our film. Push has put out a film called Push. Stillness is an illness. You know, and the premise, right, of the film is a very provocative film. 7 minutes, and it follows a family, a black family who is pregnant, and the woman suddenly doesn't feel movement anymore. And the film is great because it gets you at a dual reality, right, of what happens if medical providers listen and what happens when uh, they don't, and they are like, oh, everything is just fine. And so this movie is pivotal, I think, in what needs to happen in America. Right now, we don't have standard guidelines for fetal movement. And so, therefore, when a woman is saying, I don't feel my baby moving, depending on your doctor could say, yes, come in right away. What do you mean you haven't felt the baby move? Or your doctor can say, it's typical, right? Because we're seeing on the internet like misinformation, right? And so one of the things that we've been trying to do at Push is doing an internet scrub, talking, getting these medical websites to take down these misinformations about fetal movement, drinking juice, jumping around. Those things are practically old wives' tale, right? And so we're wanting the CDC to be able to establish a national guideline for fetal movement so that nationwide, every doctor knows that if a family is saying their baby is not moving, this is what needs to happen. We've been able to get WebMD to change the misinformation. We've been able to get What to Expect to change it, and Healthline. And so we need this to be nationwide so that this misinformation is not causing more deaths.
The educational piece is a vital one in here, and you were talking about the doctors. How important or how desperate is the need to educate doctors? Do you think doctors are well informed but just don't care or pass by because of racial disparities, or do you think there really needs to be an education of the doctors who are involved in this to so that they know what the issues are? I mean, to me, just in thinking of an answer to the question about how do you remedy this, seems to me if we educate the doctors, we're halfway there, if not much
Yes.
further down the road.
Right, absolutely. It is education, but the truth of the matter is, the United States, we're behind. Our counterparts abroad in Europe are way ahead of us in terms of stillbirth, reducing stillbirth, and we're not able to catch up. And I think it's these medical entities that need to lead the way in creating specific guidelines. To be able to get a nationwide understanding of what is important, so that families don't continue to have these losses.
It seems to me that part of the whole process for a woman is choosing the right doctor. So,
Mm,
then we're also educating the women to, to be smart shoppers, if you will, so that
yes.
if you interview a doctor or make choice of, where you want to have the baby, who you want to work with, et cetera, that you really interview the doctor and ask the right questions to get a sense if this doctor understands all of it. That's another part of the education piece.
Absolutely. I know for me, in my case, uh, for my second pregnancy, I decided that I was going to go with the doctor in which I lost my son. I went with another doctor, and she knew about my loss, and she was so attentive to my needs, to my fears. She didn't gaslight me. She really understood whenever I said, I felt like something was wrong. And I remember the day that my son was born. I called her and I said, I feel like I'm having contractions. And she was like, go to the hospital. And she met me there. I mean, her hair was wet. She was like trying to get, but she was like, I, I understand that you've had a loss, and my goal is to help you to have your baby. And so even then, she was like, your contractions are not strong, but I don't want anything to happen to this baby. So let's take him out today. And let me tell you, I appreciated that so very much, because doctors, they're delivering thousands of babies, throughout the year. But for us moms, it could be our first baby or our second baby. Even if it was our 10th baby, it's still a scary process. And in my culture, I've always heard it say that pregnancy is one foot in the grave and one foot on earth, because anything can shift and happen. Healthy pregnancies uh, can end up with a stillbirth. You can have a textbook pregnancy and still have a stillbirth. And so That alliance, that doctor and birthing person alliance is very, very important. And doctors need to trust that we know our bodies um, as much as they know the medical side of things.
You know, I'm thinking about, because I use the word, you want to be a smart shopper. People spend all the time on the web looking up to get exactly the right item. They don't want to order something from Amazon. They're going to have to return and everything else. This would be
Right,
that you want to, and both me and you are sending this message to, especially to Bronx women, because that's who we're talking to, that you
right.
should make sure you know every aspect of it, get to know them, get a good feeling. If you don't have a good feeling, trust your instincts, right? I
That's your
mean,
instinct.
these
Right.
are
Yeah.
very important things. I got to ask you this question, and I don't even know what, I can't even get my own arms around it. In this climate in the federal government and through the National Department of Health, we know who the new, uh, commissioner is of secretary is of health. Is this a difficult? I realize you're not. Nobody's backing off, but is this a difficult time to say, "Hey, take a look at this," or no time like the present? Let's just keep pushing forward. Push is the
Oh
name
no.
of the organization.
Right, right. Oh no, we'll never stop. We'll never stop. Our goal, I think it would I think for us, and I could speak for all the other directors on our team, we would be dishonoring our children if we didn't push, no matter who was in power. The goal is to save babies. That's what we're here for. And so whether we're doing our internet scrub, trying to get misinformation off the internet, whether it's our movie, whether it's paid family leave, whatever it is, we won't stop until we help all preventable stillbirths to end, and that's our goal.
You know
And
what?
we're not sure it.
Well, how preventable is it? I mean, every medical situation is obviously what it is, but
Mhm.
how preventable, is it? Some of the literature you have on your website, et cetera, talks about, preventable stillbirths. What could be done? And again, you don't have to talk about your own situation or other
Right,
women's situation, but are there preventable situations where we can turn something around and say, well, it doesn't have to turn out this way?
absolutely. I
There
think
are.
yes, standard. It needs to be a standard of care to fetal movement. Needs to be a standard of care. Fetal growth movement needs to be a part of standard of care. It's easy stuff that can be done. The same thing as strep B that we take or anything like that. Diabetes tests that we take. They just need to be a part of the standard of care, and it isn't. And it's right now up to your doctor. They should be measuring the placentas, right? Cords, measuring cords, things. Those two major things could be checked and in a birthing person's pregnancy, just to make sure. Right, we have to do all that we can to make sure that the outcome um, is well. And those are some of the steps that can be taken in a natural process of pregnancy.
This whole notion of the United States being 48th out of 49 countries in preventing, at least as I understand, the Netherlands has reduced its rate of stillbirths at 28 weeks or later by more than half. Uh,
Mhm.
what, what do they do that we could learn from and put into place to address this?
Yeah, and as well as the UK, I think they do things like the bundles. They have close care, the monitoring that I was just talking to you about. Those are the things that they have that we don't have here in America. Um, and those bundles ensure that the doctors know exactly what to look for and what to do when a woman is pregnant. And I think America, we're lagging behind because we're not taking stillbirth seriously. And it is the number one killer of children, more than guns, more than SIDS, more than anything. Number one.
That is an extraordinary number. It really is, striking. Um, on a local level here in New York City, what's the response? Now, I know the movement in the Bronx. They want to. The borough president has recommended opening a birthing center and all those kinds of things. But what is it like here in New York City? Is this a hard question to ask about? Do you get response from City Hall or from council members? You know, and from the health community. Just if you could characterize that, that would be useful.
I think things are slow. I think we do have assembly uh, members who are on board, senators that are on board with us. Right? We're The Shine Act is something that we're trying to get to pass, which would require that nationwide that copious data be taken on stillbirths. Right? So we want to know the whys. We want to continue to know the whys. Um, and along with other things that we're trying to do, I think we're trying, but I think uh, things get stuck at a legislative level. And I think but so much we can do, right? We can march, we can scream, we can yell, we can create movies, but if our government, if the people in power don't see the importance of this, then we kind of get stuck, and we
Yeah.
want to be unstuck.
Well, you know, I'm going to answer it. If they don't see the importance of this, what's wrong with them? I mean, you know, we're trying to just be logical. What is the Shine Act? You just referred to it. Explain what that is.
Right. The Shine Act is an act that would require data be taken on every stillbirth, so we have nationwide data on what is happening and what's the reason this birthing person had a stillbirth. So then we'd be able to track what is happening. What is the number one reason for a stillbirth? Right now, there's no national data. The data is all over the place, so we don't know why it's happening. And then doctors can say things like, these things happen. No, they don't. They shouldn't be happening. And the fact that we're not uh, burning to know why is a problem,
I,
because 21,000 babies are dying each year. That's a problem.
that's a big problem. I was struck again, which I mentioned earlier, the notion of preventable. If there are preventable, you know, well, we've got to attend to that. I'm curious also in terms of the health care in the Bronx and in New York City. Is there a recommendation whether a public hospital is better, a private hospital? I know North Central Bronx, for example, has for a long time has done very well with maternal health. And that's
Mhm.
obviously a public hospital. Is there a generalization that some hospitals are better, or are you better looking for, you know, an even more local provider? You know, finding your resources there. What recommendation would you make for Bronx moms or prospective
Well,
moms?
it's up to what our economic, status can
Ah,
can
good
afford.
point. Yes, very good point. Yeah, go ahead. I'm
So
sorry. That was a very good answer. Go ahead.
no, yeah, no. I mean, not everyone can afford to go to a private hospital, and so I think the bigger importance is what we said about before, right? Education of the medical providers, but as well as an alliance and an understanding about stillbirth. There's still a lack of understanding. I have a doctor friend who said that she learned little about stillbirth. It was like one little section about stillbirth and when she was going through medical school. And so there needs to be this education and helping people to understand about stillbirth. It doesn't matter what hospital you give birth in. If your medical provider is your champion, you will be fine. You will be
Right.
okay, right? Whether you're poor or you're rich, your doctor is on top of it. You will make it. And so it's really about that, right? Because the structures of hospitals, the entity, private and public, it's bigger than us, but you're talking about you and your provider one on one, and that is who needs to be your champion.
You know, we talked about a few minutes ago, we talked about education and education of doctors. I really didn't think at that moment about medical schools, but you're right.
Right.
Maybe it should be evaluated what is being taught in medical schools. Uh, you know, are these issues being discussed adequately, et
Right.
cetera? Of course, I don't know off the top of my head. In the long run, before we run out of time, what is the role of advocacy organizations like PUSH in addressing both preventable stillbirth and, of course, the underlying thing is racial disparities in maternal health outcomes.
Right. I think we want the world to know that stillbirth is an epidemic, that it is, like I said before, killing more children than any other thing in the world right now, at least in the United States, and that is something that many of stillbirths are preventable. And if we can get our eyes and our focus on making those changes, those adjustments in fetal movement, and monitoring fetal growth, right? Because that's important as well. Not all babies grow the same, right? Just like we don't all grow the same. And so paying attention to those things are important in making sure that we have greater outcomes. Now, we're not saying all stillbirths are preventable, but many are. And so that's what we focus on.
Marjorie, the last thing, how do people get in touch either with you or with Push to get the right kind of education, to get the right kind of information so that all our moms and all our children are happy and healthy?
Yeah, so we have our website, pushpregnancy.org. We're on IG, Instagram at Push Pregnancy. We're on Facebook at Push Pregnancy. I want to also encourage everyone to watch the movie. You can go to stillness .com, I believe, and watch the film and sign the petition for the internet scrub so that we can get misinformation off the internet. And so people know what to do when they're not feeling their baby move.
Uh,
Um,
Marjorie,
we're on
we're just about out of time. I just want to say this: American heroes come in all sizes, shapes, and colors. You are an American hero. Thank you so much
oh,
for
thank
everything
you,
that you do. Okay,
thank you.
we really
Yes,
have appreciated your time. And what could be more important than healthy moms and children? I can't even imagine.
absolutely,
Thank you very much
absolutely.
for joining us. All right, folks,
Yeah.
we will take a quick break. We'll be back right after this.